The next slide, I'm going to introduce and bring on our Chief Executive Officer, Jeff Green, to get us started. Thanks for joining us, Jeff. Take it away.
Thanks so much, Robert. I'll just add my welcome. Welcome, everybody. We're so happy you are here to talk about our favorite subject. And I'm kind of not kidding. Budgets are often the thing that help folks glaze over, but I think if you're working in this sector these days, you're watching this very carefully, and we know this is always important. So this is something we do at least a couple times a year, and at least on an annual basis with our friends who I'm going to introduce you to momentarily. First, I want to say a few things. Those of you that are longtime Cal Nonprofits members, thank you so much. We are a membership organization, and we invite you to join. Those that are new to us, let me tell you a little bit about what we do. We're really three things. We are a policy and advocacy network. The organization has a couple of thousand formal members, but many times that, because we work through alliances and work with other organizations, many times that they're engaged in the policy work, and it certainly takes thousands to move a state the size of California. So if you want to get involved and learn more about that, please do join us. We also do a lot of educational work, and that's what this is here today. So we try to do our best to translate what's happening at a policy level, at a budget level in the state, as well as county and federal, local as well when we're working with particular regions, and talk about what that means on the ground and what it means for the field and the leadership of our nonprofit sector. And then finally, data and research. It is, as you probably have all struggled to find, at times very difficult to get good current data on the nonprofit sector and the work that we all do. So when we see good work, we like to push it out. And in fact, our friends at the Budget and Policy Center are some of those that we frequently are pushing out what they are sharing with us in their research and analysis. But we also occasionally do our own, and right now we're doing that. If you're familiar with Causes Count, it is a report we've now done a few times over the last decade, and we're in the midst of updating that right now, which really shows the economic impact of the sector across the entire state. So that's our work. Today we're going to talk about the state budget specifically. And of course, in California, it is massive. It is something that when I talk to my colleagues in other states, it's really hard to sort of describe just how big our state is with respect to people and dollars and budgets and all the things that move through the state of California. So a few thoughts for today to start us off. This is our very high-tech animation that we were joking about just before the session started. But let's take a look through these, if you would, Robert. So it's important to note that state budgets and budgets in general are dynamic, and they're always dynamic. So yes, there is a set budget that gets adopted, but what happens before that and what happens after that, it is not entirely frozen in time and space. And so it's important to note that in this context, advocacy matters, relationships matter, and we'll talk about that. I'll end on a bright note here before we get into a darker place as we talk about our current state budget. Second thing we should talk about are the fact that the constant negotiation that goes on behind the scenes. Most people probably, and those of you here today, I know are by definition, you're interested in this, and some of you are very deep in the weeds and have worked with state budgets for many years. Others are probably newer to it. The 2 or 3 points that people probably know, and you're going to hear from Scott and Laura a lot more about this process and how it works, but early in a new year, you'll get the governor's proposed budget, and then we have what we call the May revise in May of each year, and then ultimately the legislature adopts a budget. But behind the scenes, through every legislative office, committees, there's constant negotiation about what should be where, how much could be spent on what, and of course, making best guesses about revenue. So just know that although it may look like it's just a few pieces, it is constant in the political sense, budgeting. The other thing to note is that California is hyper-dependent on a relatively few high-income and high net worth taxpayers for its revenue. This is something that gets talked about a lot. It's why we have such extreme budget swings. And I know our presenters will talk a bit about this and why we need to think about how that impacts what we can and cannot do in our state and what we can and cannot plan for. But this also means that markets and investment markets and things like that are particularly valuable to those with much has a huge effect and really an outsized effect on our state budget. Next, we should always acknowledge that the reason this is so directly important to the nonprofit sector is that roughly 1/3 of all nonprofit revenue comes from public grants and contracts. So Federal, state, and local budgets matter for lots of reasons, but one of them that's directly relevant to what our nonprofits do and have to work with is that roughly a third of our revenue across all subsectors. And I think it's important to note that some subsectors never take a public dollar throughout their entire existence, and others are entirely dependent on it, and most are somewhere in between. So as of our last set of data, majority of nonprofits have some public money in their revenue stream. But depending on what part of the nonprofit world you work in, what happens at a state budget may have a huge impact on your organization or relatively small impact. And then finally, budgets really do show our values and priorities, why we talk about this constantly, and I know we all talk about this in our organizations as well, which is, don't tell me what you believe, but show me what's in your budget, because that really says what you invest in, what you value. And so we are constantly in conversation about what those values should be and how they should be reflected in our budgets. I will add two things. You're going to hear about where we're at as a state right now, and it's not a great place. For those of you that have been working in California and looking at California state budgets for decades, you'll remember previous times where we were in steep downswings and declines in what we are working with. And we're there again. Not the worst ever, but certainly not what it looked like over the last few years. And so in that context, those negotiations and that advocacy is so important and so much more critical than even in a good year, and it's always critical. And so I want to share that there are two things that happened this year that give us some examples of why advocacy is so important from the nonprofit sector. The first is our foster family agencies, FFAs, that ran into one of the many emerging insurance crises, which have long existed but got particularly acute in the last year. And even in a down budget year, they were caught between a state that demanded a certain level of insurance, but also made it nearly impossible to get said insurance. And so there was actually an allocation in the budget in a deficit year that bridges our FFAs through this period. And it's just a short bridge. It's a Band-Aid, not a solution for sure. But there is a really vibrant coalition working together that we're part of that got that. And that's a win in a budget like this to get $32 million into the budget. And the other thing I will say is there was a really creative proposal during COVID for those working in the performing arts. AB5 made it very difficult to be a performing arts worker who was then redefined specifically out of gig work. So how do you have a compensation structure that actually allows someone to not just survive but thrive? And there was a small but important piece of the budget, roughly $11 million, that the governor had originally stripped out that went to support performing arts organizations to make sure that they could pay their performers. And due to the advocacy of some of our colleagues, particularly California for the Arts and their alliances, that was put back in the budget. So it does matter. Your advocacy is critical. Our advocacy is critical. And I'll leave it there with my comments. And now I want to bring on our experts, two of our favorite friends who spend a lot of time thinking about, writing about, parsing and analyzing budgets. And you're going to hear from both of them today. So we have Scott Graves, who is the budget director at the California Budget and Policy Center, and Laura Pryor, who is the research director at the California Budget and Policy Center. And we are grateful to you both for joining us again. And we will pass the mic. Thank you so much.
Thank you so much, Jeff. I'll go ahead and start us off and share my screen. So thank you again for having us. We're really looking forward to what is certainly a dark but also informative presentation, focusing on the state budget, but also focusing on what's happening at the federal level, given the impacts that it is going to have on our state budget and our state more broadly. So in terms of what we'll be covering, my colleague Scott will kick us off with highlighting just why budgets matter to begin with, and then reviewing the state and federal context. And from there, I will take over and describe some key provisions that were in our state and federal budgets. And then Scott will close with a preview of what to expect next. So that's our roadmap for today. And with that, I will pass it over to you, Scott, for the next section.
All right, thank you, Laura. And it's great to see so many of you on this call today. It's always exciting when you're the budget director of an organization to see so many people excited about budget. So thank you for joining. I'm going to start us off today, maybe reinforcing or building on a point that Jeff made in his opening remarks. We all know that budgets, of course, are made up of dollars and cents. It would be quite surprising to open up a budget and find no numbers in there. The California state budget has hundreds of billions of dollars that flow through it. But really the bottom line here that we like to emphasize is budgets really are statements of our values and priorities. That's what we're all debating and arguing about every year. Yes, the dollars matter because they can make a difference in whether programs get off the ground or not. But beyond that, the dollars are helping us to all understand what do we really prioritize as a state. And as Jeff said, you can really suss out someone's priorities just by looking at where they're putting their dollars in the budget. It's also on the next slide important to note that budget choices really do affect everyone. They affect whether kids have a safe place to be while their parents are working, whether young adults in California have access to an affordable and quality college education, whether older adults and people with disabilities in California can live in their own communities with dignity, and so much more, of course. So at the root of this all, what we like to remind everyone is that budget choices are answering the question in California, what kind of state do we want to live in? And of course, the corresponding question at the national level is, what kind of country do we want to live in? So if you're tired of the back and forth and wondering why can't everyone just get along and stop all this partisan bickering, it's because there are legitimate and genuine arguments about the direction that public policy should be moving in your city, your county, your state, and at the national level as well. And they are all trying to answer this question. What kind of place do we want to have? What kind of place do we want our kids and grandkids to grow up in? That's what this debate is about every year. Next slide. So what I want to do now, before we get into the details of what actually happened in various issue areas, Laura is going to be covering that at the federal and state levels in terms of budgets that were recently passed. I just wanted to walk through some key context, both at the state level and then at the federal level. So let's start first with the state level. So it's pretty clear to all of you probably that a budget deficit was identified for this year. And that was the task of state leaders in May and June to figure out how to close the deficit that Governor Newsom identified. That deficit was due to a lot of reasons. At the simplest level, revenues just didn't come in at the levels that were expected earlier in the year, even late last year, and costs were higher. So, that's probably not very surprising. This is often something that will happen in state budgeting or even budgeting at other levels. Revenues may not meet expectations, costs may be higher. Sometimes that is flipped. This isn't one of those years when it was flipped. We had a situation where there weren't enough revenues coming in to meet the expenditures that were already on the books. So state leaders had to address that. At the same time, we're all aware of these ICE raids that have been going on across the state, particularly in the Los Angeles area for several months now, that have been terrorizing communities. And that sort of has really drawn the attention of state policymakers, advocates, and others to the interaction between the federal government and the state, setting up this, long-running conflict that we're seeing between President Trump and Governor Gavin Newsom. And then one other key point we want to raise as part of the context is something that we always say at the Budget Center is to remind ourselves that state leaders can always do more to ensure that Californians can make ends meet. We're a big state, we're an innovative state, we're a wealthy state. We are never out of options in California. So don't ever let policymakers tell you we can't do something in California. California has been a can-do state for decades, and we can continue to do that in the future as we face many challenges. Okay, next slide. Jeff covered a little bit on budget process. We have an entire budget process presentation. It's a 101 training. I'm not doing that today. We're just sharing this one slide just as a reminder again. And this is just part of the budget process, right? This is the most transparent and visible part. There's the other half of the year, there's just as much going on. We just don't see it. So back in January, the governor did release, as required, by January 10th, his proposed budget for the fiscal year that started this past July 1st. We talked about that. Everybody debated it. There was lots of legislative hearings and testifying. Then we got to May and the governor released his revised budget proposal. That's when he said, unlike in January, I'm now seeing that we're probably dealing with a deficit here, and we're going to have to figure out how to close that. So that was the first indication we had officially that California state leaders were going to have to close a deficit for this fiscal year. Back in January, the governor was saying, the budget is roughly balanced. So that changed by May. And then, of course, in California, we are required to have a budget passed out of the legislature by June 15th. That happened. And then, as always, there's this mad dash to complete negotiations with the governor, make changes to the budget as passed by the legislature, and then, of course, adopt all of those wraparound bills that go with the state budget that are known as trailer bills, right? Dozens of those get passed every year. And those are the bills that just put the budget into effect. They make the state law changes that are needed in order to implement the policies assumed in the state budget. So in that sense, the process this year, was fairly rote, right? There was nothing really spectacularly new about this. We just continued the process as we typically would. But there were some differences in the sense that we had a deficit this year. Other years recently, we have not. As Jeff noted, things tend to go up and down in California. This was one of those down years in terms of revenues. Okay, next slide, please. So top lines on the budget. This is where there can be some confusion here because Governor Newsom was describing the deficit in a way that I and my colleagues didn't consider to be very helpful. So the governor kept talking about an $11 or $12 billion budget deficit, quote unquote. Well, what the governor was actually doing there was saying, we have a budget deficit, and we also want to leave some money in our state's discretionary reserve as like a cushion, just in case, as we know will happen, things change and we need to draw on some money. So we're not going to allocate every dollar. We're going to set aside some dollars in our discretionary reserve. So when you look at those numbers separately, there was a $7.3 billion budget deficit, a genuine deficit. Then they also made a decision to set aside $4.5 billion in the state's discretionary reserve. This is different from the rainy day fund that I'll talk about in a second. When you add those two together, you get to $11.8 billion in budget solutions. I'm not going to go to that slide yet, but we do have a chart that I'm going to walk you through briefly, or a donut chart, to show you how those solutions broke out. But that's the first thing to keep in mind. For those of you who have been following this for a while, also, that's not a substantial deficit compared to what our state has faced in the past, during the COVID pandemic, during the Great Recession, and at other times. Dealing with a $7 billion deficit, that was a relatively modest deficit by California standards. In terms of overall general fund spending, they're budgeting $228 billion. Again, that's just the state general fund. That's not federal funding. That's not special funds, no bond funds in there. When you just look at the general fund, which is kind of like the state's main checking account out of which most of our expenditures are paid, $228 billion, that's a few $billion less than the Democrats originally wanted. In their negotiations with the governor, that number came down a bit to 228. And then one other point I want to make here is that they did pull about $7 billion from our constitutional rainy day fund. So this is actually in the state constitution. Voters approved it by passing Prop 2 over a decade ago. This is different from the discretionary reserve I mentioned. There are really few rules around the discretionary reserve. They can put money in, take money out whenever they want. There are pretty substantial rules built around this constitutional rainy day fund. So as part of the budget deal last year, they made an early decision to use $7 billion from this constitutional reserve to help close a gap that they anticipated for the next fiscal year. So that was an oddity because they decided to do a 2-year budget last year in the summer of 2024, right? Usually California just does 1-year budgets. They kind of did a 2-year budget last year. And in advance, they said, we're going to use $7 billion from the rainy day fund to plug the deficit we see coming in the following fiscal year. So it gets confusing because the $7 billion was already built into the governor's January budget proposal. They assumed that it would be used. And that really was why we ended up with a roughly balanced budget in January, because they were already assuming the $7 billion would be used from the rainy day fund. By the time you got to May, the governor said, oh, things have actually deteriorated. Revenues aren't coming in as strongly as we thought. Spending is higher in many issue areas, including for Medi Cal, our state's health coverage program for residents with low incomes. So that is why there may be some confusion around how all these numbers work. I'm hoping that I didn't make things more confusing for you, but before we jumped into the numbers, I wanted to make sure that I provided a little clarification around how these things relate. Okay, so I said they did about $12 billion, thank you, Laura, in budget solutions. It basically breaks out into three categories. So the orange part of this donut chart, that reflects internal borrowing. So over half of their quote unquote budget solutions to close the deficit and build a $4.5 billion discretionary reserve, those largely came from borrowing. What does that mean? We have a lot of special funds in California, as many of you probably know. A lot of these special funds have big balances. The balances are just sitting there. They're not needed right away, not for the current fiscal year. So the legislature says, hey, let's go in and take some of the balance from that special fund and use it to temporarily pay for general fund costs, which helps to close the general fund gap that they identified. Then, when they can, within 2, 3, or 4, maybe 5 years, they will pay back the special fund that they borrowed the money from at a small interest rate. So essentially, this means the state is borrowing from itself, moving money from one account to another account in order to help close the deficit in the general fund without the need to make more or deeper cuts than they were already considering. Okay, so moving clockwise around this chart, sorry, the next sort of light blue section there, that represents spending reduction. So there were genuine spending cuts in the state budget. They made up about 1/4 of these budget solutions. Laura's going to talk more about those, but sadly, a lot of those were targeting immigrant Californians and their access to healthcare. And finally, there was one more big category of solutions. This is known as fund shifts. So we had about 20% of these solutions were made up of fund shifts, which essentially, it's kind of like borrowing, but it's a little bit different. So essentially, they're shifting general fund costs onto another fund. Like they did this with the managed care organization tax, which you may or may not know much about. I'm not going to get into the details of that. We also have a greenhouse gas reduction fund. Some state costs normally paid out of the general fund could be paid out of that fund. So those are the main ways in which they close the $7 billion state budget deficit for this fiscal year, and also had enough money to set aside just under $5 billion in our discretionary reserve. Okay, so I think that covers the state part of the, oh, no, this doesn't. Here's what I wanted to say here. You may have noticed that I didn't mention anything about new revenues. That's because there were no new major revenue increases as part of this budget deal. It was talked about. Some legislators were pushing for it. It didn't get any traction. Neither the governor nor legislative leaders, at least at the moment, are interested in moving in that direction. So there were no revenues to help close the deficit, avoid some of those spending cuts that I mentioned at a high level and that Laura will get into in a little more detail, and to buffer against federal cuts. So this is something, this conversation is going to continue, and we may be hearing more about the need for and the prospect for revenues in the coming weeks and months. Next slide. All right, I'm going to shift gears now and take a look at some of the context at the federal level. Okay, so here, some of you may have been closely following maybe the so-called reconciliation process that was going on in Congress from early this year all the way through July 4th, when they managed to pass the bill in early July and send it to President Trump for his signature on the 4th as he requested. This is a massive, nearly 1,000-page bill that really includes a lot of unprecedented and radical cuts, where they have decided that they're going to gut vital programs like Medi Cal and CalFresh, which is California's major food assistance program. And let's be clear why they decided to do that: because they needed to find a way to fund some of the trillions of dollars in tax cuts that are largely going to benefit the wealthy and corporations. So that was a clear trade-off they made. And if you'll recall at the outset, Jeff said it, I said it, budgets are statements of our values and priorities. I don't think you could get a much clearer statement than that. We believe that these cuts are going to pose risks to our state's economy as well as to Californians' health and well-being as the implementation of these cuts rolls out. And to tell you something you probably, again, already know, we've been sharing this for months now, this chart, it's been updated again, that federal funds really provide substantial support through our state budget. Our state budget, as enacted in June, is just shy of $500 billion. The state is expecting about $175 billion from the federal government to flow in. That's more than a third. More than 1/3 of our state budget comes from federal funding. Part of the reason why we're not seeing a huge drop is because a lot of the implementation dates of these big cuts in the federal reconciliation bill have been pushed off to beyond the midterm elections next year, right? So in order to avoid a lot of the major impacts of these cuts that are in the bill, they pushed them off till 2027 or maybe a little bit later, so that the impacts wouldn't be felt before Americans went to the polls and decided who would control Congress next November. So the thinking is that federal funding will continue to flow to the state more or less as expected, of course, with the hiccups involved in President Trump's on again, off again decision to unconstitutionally withhold funding, which I'll come back to in a moment. But at the moment, we're thinking we're going to see about a third of our budget supported with federal funds for the current fiscal year, which of course is huge. Okay, next slide. And before I hand it over to Laura, just to put a fine point on this at a really high level, what happened in this federal reconciliation bill? They cut funding for Medicaid, our Medi Cal program in California, by nearly $1 trillion. That's over a 10-year period, and that's national. They're shifting massive new costs for SNAP. That's what we know as CalFresh here in California, food assistance, to states for the first time. So asking states to take on costs they have never had before, or relatively small costs are now going to balloon as a result of this. And they made other harmful policy changes affecting food assistance as well. They decided to accelerate President Trump's deportation agenda. While they didn't have enough money to support Medicaid and food assistance, they did find $170 billion in new funding to build up ICE and help to further militarize our border with Mexico. And there's also trillions of dollars in tax giveaways to corporations and the wealthy. So that at a high level sums up some of the major changes that were included in the federal reconciliation bill signed by President Trump about 1 month ago. And with that, I'm going to hand it over to Laura for some of the details.
Thank you, Scott. So as Scott mentioned, I'm going to talk through what was in both the state and federal budgets related to some of the key issue areas that we cover. And I want to preface this by saying this is a lot of information. It's dense and it's also pretty detailed. So we do have resources on our website that Scott will share or we'll go over in slides at the very end. But I just wanted to preface that, and thanks for bearing with me as I go through these details. And as mentioned at the outset, there will be time for Q&A at the end if there's anything we can provide additional clarity or re-go over at the very end. So at that disclaimer, I'm going to jump right in, and we're going to begin with the health issue area, specifically in the state budget. As Scott mentioned, there's a lot going on in the federal budget related to health that specifically targeted immigrant communities, and we're seeing this also in our state budget. So specifically, the state budget freezes new Medi Cal enrollment for undocumented adults ages 19 and older starting this coming January. However, state leaders did agree on a 3-month re-enrollment period and protections to prevent people from aging out of the program. The state budget also imposes a burdensome $30 monthly Medi Cal premium for certain immigrants ages 19 through 59, starting in July 2027. However, as noted, pregnant people are excluded from this cost-sharing requirement. And thirdly, the state budget eliminates Medi Cal dental benefits for certain immigrants starting July 2027. So once again, we are seeing our immigrant communities in California targeted in our state budget. Talking about Medi Cal more broadly, there are health cuts in the state budget that would affect all Medi Cal enrollees. Namely, the state budget reinstates what's called asset limits in Medi Cal, and this is setting the limit at $130,000 for individuals and $195,000 for couples starting this coming January. These asset limits threaten the financial stability of older adults and people with disabilities. Secondly, the state budget ends coverage for GLP-1 weight loss drugs, otherwise known, for example, as Ozempic and Wegovy, and this is starting this coming January. And thirdly, the state budget imposes step therapy protocols and prior authorization for certain drugs beginning this January. And as a result, this may delay care and disrupt stable treatment for people with chronic conditions. There is a little bit of good news in our state budget related to health, and this is with regards to behavioral health initiatives. So the state budget does sustain some behavioral health initiatives, namely our BH Connect program, which was launched in January and aims to improve access to behavioral health services for those with significant needs. Additionally, the state budget agreement continues other behavioral health initiatives. This includes our California Advancing and Innovating Medi Cal, or CalAIM program, the Children and Youth Behavioral Health Initiative, Care Court, and Proposition 1, which was passed in 2024. So in sum, there is a bright spot with behavioral health. However, our state budget, we are seeing some pretty harmful proposals specifically targeting immigrant communities and Medi Cal recipients. So this is further exacerbated by what happened in the reconciliation budget that was recently passed at the federal level, which I'll just refer to as the federal budget. So getting into the details of health in the federal budget, this reconciliation bill limits access to health coverage through Medi Cal. So at the federal level, it's Medicaid. In California, it's Medi Cal. So specifically, this federal budget creates burdensome red tape by forcing adults in the ACA expansion population to prove that they're working, looking for work, or participating in job training programs, otherwise known as work requirements. So you have to work in order to receive health insurance. Specifically, this will impact about 3.5 million Californians that are expected to lose coverage because of these work requirements. Secondly, the federal budget now requires eligibility checks every 6 months as opposed to every 12 months for adults in the ACA expansion population. And thirdly, we're seeing that this federal budget now excludes certain immigrants from Medicaid or Medi Cal in California and CHIP. And this is including most humanitarian groups, leaving only green card holders, certain Cuban and Haitian immigrants, COFA migrants, and some children and pregnant adults eligible. So this is pretty devastating to our immigrant communities in California. Again, only coupling with the state budget implications for our immigrant communities is very harmful. So moving on to what's happening with covered California as it relates to federal budget actions. So in the federal budget, it failed to extend enhanced premium tax credits, which are set to expire at the end of 2025, so the end of this year. And these enhanced premium tax credits help low and middle income families afford health coverage. So because of this, about 1.8 million Californians would face higher premiums, and up to 400,000 Californians may lose coverage due to these high premiums. Secondly, the federal budget ends marketplace subsidies for lawfully present immigrants, which does include people with visas, refugees, trafficking survivors, and DACA recipients. So again, additional attacks on our immigrant communities. And this would impact nearly 112,000 covered California enrollees, and this population would also be excluded from Medicare eligibility. And thirdly, the federal budget penalizes people with fluctuating incomes by ending protections on tax credit repayment and limiting cost-sharing help. So in sum, what we're seeing both at the state and federal level is really devastating to our health area and access to healthcare in California, specifically to our immigrant populations. So with that said, I'm going to move on to talking about economic security. first beginning with what was in our state budget vis-a-vis economic security. So overall in economic security, it's kind of a mixed bag. We're seeing some investments and protections, but overall at the Budget Center, we still think our state budget is falling short. So getting into some specifics here, in our state budget, we are seeing that the state maintains planned expansion of what's called the California Food Assistance Program, or CFAP, to include undocumented adults ages 55 and older starting October 2027. So this planned expansion has been maintained, which is great. We're also seeing a one-time investment for our Cal Food program, and it's keeping funding at the same level as our last fiscal year. We're also seeing our state budget removing some barriers in an effort to streamline CalWorks, and this has been a really great win for our CalWorks advocates. So specifically what we're seeing is the budget includes expanding the activities that fulfill the job requirement, deferring sanctions, and eliminating county share of the federal penalty. So this is an improvement to our CalWorks program. So despite what we're seeing is, more or less a mixed bag, but some bright spots in our state budget related to economic security. On the federal side, as Scott alluded to in his earlier slides, we are seeing a lot of really devastating blows in this area. So honing in specifically, this reconciliation bill, again, at the federal level, cuts our SNAP program, which is CalFresh in California, which is taking food away from families and children. So the specific actions that are being taken related to SNAP is that it shifts up to $1.8 billion or 15% in the SNAP benefit cost to California. So this is more money that California is going to have to take on to fund our CalFresh program, which is going to create a huge state budget cost pressure. Secondly, the federal budget does expand harsh time limits to caregivers of school-aged children and older adults between the ages of 55 and 64. And this will put nearly 368,000 Californians at risk of losing some or all of their food assistance benefits. Thirdly, continuing attacks on our immigrant populations. The federal budget blocks SNAP enrollment for certain immigrants who are not naturalized citizens or do not have a green card. And lastly, we're seeing the federal budget permanently freezing the cost of what's called the Thrifty Food Plan, except for inflation adjustments. So this effectively decreases the already limited benefit amount that our communities receive through our food assistance programs. So again, while we are seeing some things maintained related to economic security and food assistance in our state budget, what's happening at the federal level related to CalFresh is really going to blow a huge hole in our state budget. And our state leaders are going to have to figure out how they're going to address this specifically $1.8 billion cost shift that was coming to California. So now shifting gears to housing and homelessness, I'm going to specifically talk about what's happening with homelessness and affordable housing in our state budget. The housing proposals are really still in flux at the federal level because they're moving through a separate budget process called appropriations. So what you're going to see on the next few slides are really just focused on what was in our state budget. Beginning with homelessness, the main thing to know is that we're not seeing any new funding for this fiscal year for the Homelessness Housing Assistance and Prevention Program, or HAP program, which supports city and county efforts to address homelessness. So the budget does provide $500 million for the next fiscal year, so 2026-27, but this funding does come with some new strings attached. Secondly, the state budget includes about $209 million for homelessness and housing programs for only specific populations, including people with disabilities. And lastly, we are seeing $100 million in the state budget for a grant called the Encampment Resolution Grants, which local governments use for services and supports to help people move to safe and stable housing. So there's no significant funding to address homelessness, given what was shown, only some drops in the bucket for what we know is a very serious problem in our state. Moving on to affordable housing, the state budget has just some limited investments related to affordable housing. Specifically, there is an additional $500 million for the low-income housing tax credits, And these low-income housing tax credits have supported affordable housing development since 2019. Additionally, the state budget has advanced what's called CEQA and state administrative reforms to promote faster housing production. And thirdly, several vital and oversubscribed affordable housing related programs continue to face funding cliffs and did not receive any new funding. So again, while we are seeing our state budget sort of plug a few holes when it comes to homelessness and affordable housing, we're not seeing any substantial or sustained investments to help address this crisis. Moving on to education and our state budget, it's a little bit of a rosier picture. Not to get into the weeds, but our public education dollars are funded through a dedicated source called Proposition 98. And in this context, it has meant that the state has been able to place some additional investments in our public education system, as I'll get into in my next slides. So primarily, the state budget does boost key supports for schools, specifically by maintaining something called the Student Support and Professional Development Discretionary Block Grant. So this is $1.7 billion one-time funding for this grant. And the purpose of this grant is for mental and behavioral health services, staff training and development, expanded learning, and other local needs. And speaking of expanded learning, this is our after-school programs in California in our public schools, and our state budget does expand access to these after-school programs, otherwise known as the Expanded Learning Opportunities Program, or ELOP. So this expansion will increase the number of schools eligible for the program by lowering the needs threshold, and it doubles the minimum grant amount. So that's great to know that our state budget is investing more in our after-school programs. The other bright spot related to education in our state budget are investments in the teacher workforce. So specifically, the state budget invests about $300 million, again, one time, into what's called the Student Teacher Stipend Program. So this funds $10,000 stipends for candidates who complete 500 plus hours of student teaching. And secondly, it provides $200 million, again, one time, for something called the Literacy Professional Development Program, which includes in-service training for TK through 5th grade educators. And lastly, the state budget has $70 million for the Teacher Residency Grant Program and includes an expansion that targets areas with teacher shortages. So again, on the state side, with our K-12 public school system, we are seeing some additional investments to support students and the teacher workforce. On the federal side, we are seeing some very serious attacks specifically to higher education in that reconciliation bill. So getting into the specifics of that, this reconciliation or federal budget that was recently passed limits access to student loans. Primarily, it cuts over $350 billion in federal investments that have helped to make education more affordable. It also changes Pell Grant eligibility rules, limiting access to the program and making higher education less affordable. And lastly, it limits the amount of loans that students can take out, making it harder to afford college tuition and likely steering some students towards some predatory private loans. So while we have some great investments at the state level in K-12, what's happening at the federal level related to college access and affordability is something that the state is going to have to perhaps address in the coming years, given these changes at the federal level. And lastly, I want to talk a little bit about what's happening related to tax and revenue. As Scott mentioned in his earlier slides, a lot of what you're seeing in the federal budget in terms of cuts to things like SNAP and Medicaid are all in response to additional tax breaks for wealthy individuals and corporations. So more specifically, in the federal budget, we are seeing huge tax cuts for the well-off and further erosion of the child tax credit. So namely, there's $4.5 trillion in tax cuts for individuals and corporations across the nation over 10 years, with the top 1% claiming $1 trillion of those benefits. So let that sink in a little bit. The top 1% claiming $1 trillion of the benefit. So in California, this translates to the top 1%. They will receive on average an annual tax cut of $35,000, while the bottom 20% will receive just $100 on average. So that is a huge gap that's further exacerbating income inequality in our state. And adding on to that, as noted, we're seeing further erosion of some very important tax credits. So the federal budget continues to exclude 2 million California children from the full child tax credit because their parents' incomes are too low. Also, it denies a child tax credit to US citizen children who don't have a parent with a social security number. And it also denies additional tax benefits to people without social security numbers, such as tax credits for college students. So overall, again, if budgets are statements of our values and priorities, what we're seeing in this federal bill is prioritizing the top 1% at the expense of critical programs that are going to impact Californians. And our state leaders are now having to confront years to come with what's happening at the federal level in terms of how the state is going to be able to step up and address these changes to make sure that California continues to be a place where all residents can thrive. So now I'm going to shift gears back to Scott to talk about what's next, both at the state and federal level.
Thank you, Laura. And Laura, I also want to let you know there have been some good questions coming into the Q&A box. I've been attempting to answer some of them. You might want to scan them. And if you have any answers you want to drop in, go for it. So what is next? Let's start with the federal level. And I'm keeping in mind that we're bumping up against our time limit here. So there's really three things to look at the federal level. First, there's President Trump and his approach to politics and policies. I mean, there's no way to sugarcoat this. He has been clearly eroding the rule of law, including unconstitutionally withholding funds that were appropriated by Congress. We think that we can expect to see more of this in the near future, in fact, over the longer term as well. We also can expect to see more efforts to cut spending, including making additional requests to Congress to cancel previously approved funding. This is the so-called rescissions process. And some of you may be aware that within the last month or so, Congress did approve a $9 billion rescission, essentially canceling $9 billion in spending that had been agreed to with Democrats just a few months ago. And most of that cut is to public broadcasting, public television, and public radio across the nation. So we can expect probably more rescissions requests to be coming from the White House to Congress in the weeks and months to come. Next, the budget reconciliation rollout, right? This is the massive 1,000-page bill. Laura just gave you some of the details on that. Obviously, there's a lot more. One thing to keep in mind, as I noted earlier, is that there's not one giant implementation date. Like, it all doesn't take effect on October 1st of this year, the beginning of the next federal fiscal year. These implementation dates are going to roll out. I already noted, as Laura noted, and I emphasized in the chat, some of the first people who are going to feel impacts in California are families with lower and middle income families who have been relying on federal assistance to purchase health insurance through Covered California. This is almost 2 million people. They're going to be the first to see sticker shock in a couple months when these new premium rates start going out, because these federal subsidies are being allowed to expire. Other types of changes in the bill won't take effect till next year or maybe the year after. So that is an important thing to keep in mind, because it means state leaders don't have to try to deal with everything all at once. They can take a more staged approach to addressing the impact of these cuts on California. And also, the feds are just going to need to offer guidance to states. Many of you who are familiar, with the way Congress writes bills, a lot of it is very vague and it's not clear what it means. They leave it to the executive branch to decide what it means. That means the Trump administration needs to be writing regulations and providing other guidance to states if they expect states to be implementing the policies that are included in this giant reconciliation bill. So we should expect to see a lot of regs and other types of guidance coming out in the coming months, and maybe even over the next couple of years, to help states understand what the heck they're supposed to do in response to some of the policy changes included in the budget bill. And finally, I wanted to note that, and this is something my colleagues and I have been learning this year, because we don't spend a lot of time until this year looking at the federal budget. There's this whole other thing that happens in Congress. Many of you are probably familiar with it. It's called the appropriations process. And this is just sort of funding the basic day-to-day operations of the government and some key programs like funding for housing and funding for education. It all goes through this separate process that has nothing to do with this reconciliation bill we were just talking about, but they're funding what is known as discretionary federal programs. So if you ever hear discretionary, quote unquote, they're talking about the programs that are funded through this appropriations process. President Trump has proposed some pretty deep spending cuts, but they're not going anywhere because unlike the reconciliation bill, which only needed a majority vote in the Senate, 51 out of 100, well, actually the vice president had to sign on to that. This actually needs 60 votes. So the Democrats have the filibuster, and that means Democrats and Republicans, as always, have to agree on what the appropriations levels will be for the upcoming federal fiscal year that starts on October 1st. So that does give the Democrats some leverage here. And so we're going to be seeing, again, probably down to the wire negotiations into late September, as happens, it seems, every year, where people ask, are we going to have a, quote, government shutdown? The reality is the government never shuts down entirely. But if they ever did take it to that level, there would be some services and programs that would stop receiving funding, and it would create chaos in various ways, which is why they always will end up creating some kind of continuing resolution where they say, hey, let's just keep spending going for another couple months, and we'll kick the can down the road and we'll come back to it, later in the year or sometime in 2026. So this whole appropriations process is going on in Congress right now. Not much is going to happen until September because Congress doesn't really do much unless it's facing a significant deadline. And October 1st, the start of the new federal fiscal year, is the deadline that's going to spur some kind of action unless Democrats just dig in and say, we're not giving you anything, and they move toward the government shutdown mode. Let's look quickly at the state level. There are a few things happening at the state level. Many of you are aware that when the governor signs the budget in June, that is not the end of the story, right? Jeff mentioned at the outset, budgets are dynamic. They're always negotiating. Every year in August, and when they meet in September, like this year, they continue to negotiate the budget. Sometimes it's just technical corrections, right? That's called cleanup, right? They work hard and fast and things don't get done quite right. They clean it up in August or September, but they can also make very substantive changes. Given what we just saw passed at the federal level, signed into law on July 4th, they know that they're going to have to respond. State leaders, the governor, the legislative leaders are going to have to figure out what California's response will be. The Assembly will be holding a hearing on August 20th. At 9 a.m. to have their first sort of look at what this might mean for California. They're going to hold more hearings rolling out into next year. But this is going to be advocates' first opportunity to sort of see where are they and to make the case for certain kinds of responses to these federal cuts at the state level. A lot of people have been asking, second bullet point here, is the governor going to call a special session? Answer, no one knows. At this point, it doesn't seem super likely. Of course, it's possible. But because of the way the implementation dates are rolling out, while state legislators and the governor need to be focusing and having a plan in place and figuring out what to do, they have some time to sort of craft their responses. And from what we've seen, they don't seem super interested in moving really fast. So there's a slight chance that the governor could call a special session, but it seems more likely that what will happen is instead of that, we'll see the governor in January when he's required to release his proposed budget for the next fiscal year. We'll start to see what the governor's response is to the federal reconciliation bill and what it would mean for California and the kinds of policy changes that he would be recommending. But of course, I'm not ruling it out entirely. We could see a special session. Doesn't seem super likely at this point. Okay, before we close out, I wanted to remind you, if you've never been to the Budget Center's website, please visit when you get a chance. We've got a ton of resources on there to help you understand what's going on at the federal level, at the state level. Earlier this year, we created a new federal policy page, which you can find right at the top of our website that brings together all of our federal policy work. Earlier this year, we also launched a new Budget Academy that brings together all of our process-related work to help advocates understand how to effectively engage with this process and get the policy changes that they want to see. So that's at budgetacademy.org, or you can get to it from our website. So with that, I wanted to say thank you on behalf of both Laura and I. I know we're running short on time here. I'll leave it to our host to decide the Q&A here. Thank you.
Thanks so much, Scott and Laura. That was a great rundown. I really appreciate you providing both some context on process, the impact of the federal government, as well as the state. There are some questions in the chat, and we're just going to spend a little bit of time touching on some of the ones that I've seen a few people different asking about. And I think one of them is something that a lot of people talk about, and it comes from Santiago here. And he says that Governor Newsom constantly claims that California is, quote unquote, a donor state, meaning that it gives more than it receives from the federal government. Can you explain from this comment in relation to your slide that says that California depends on federal funding for 35% of its budget?
Yeah, well, I worked on a brief piece on this. Maybe Laura, if you can find it and put it in. All right, yeah. So my colleague Nishi Nair and I just basically synthesized work done by the Rockefeller Institute out in New York, where they do this. I don't think it's annual, but they are asking the extent to which states are paying more in federal taxes than they are receiving back in federal funding. Now, keep in mind, states, quote unquote, do not pay taxes. The only people who pay taxes are you, me, and other individuals in California and businesses, right? So that is where the taxes are coming from. Then Congress and the president get to decide how to allocate those tax dollars. Given that California is such a large and innovative state with a very dynamic economy, and given the way federal taxes are structured, California sends a ton of money to the federal government, right? We don't get all of it back, right? There's an $83 billion gap, roughly, the most recent data available for federal fiscal year 2022. Basically, we send $83 billion more in individual and corporate income taxes to Washington, D.C. than we receive back in federal funding. Now, I want to point out that we don't necessarily see that as a problem, right? This is a country. We don't want government treated as a vending machine where if I put a quarter in, I damn well better get a quarter in value back, right? The idea is we send taxes to the feds and our national policymakers make decisions about how to prioritize those dollars that are coming in from all of the states. What it in fact means is that California is subsidizing probably a lot of quote unquote red states that don't pay as much to Washington, D.C., but have populations that have great needs, like who need SNAP assistance, right, for their food, who need healthcare through Medi Cal. So basically, Californians, our businesses, our individual taxpayers are quite generous with the support that we provide across the nation to help everyone make ends meet. If we got all of those dollars back, would that be better for California? I guess it might be. We would have more federal funding, but that would also mean there'd be a lot of other people across the country, including in some very red states, who would be facing much more dire circumstances because they would be losing a lot of federal support that they currently receive.
That makes a lot of sense.
Okay.
Thanks. I've got one more question here from Carla, and it kind of dovetails into this. And Carla asks, please help us understand what provisions of the federal budget can be reversed, if any.
Everything, my understanding is that everything would be reversible. If in 2028, voters nationally decide, let's say, to elect a Democratic president and Democrats take over the Senate and the House, although, of course, a lot of things in the Senate require the supermajority, which can make it challenging. But let's just say, they ended up taking over all those two branches, the presidency and Congress. A lot of this could be undone because these are just laws, right? So Congress cannot bind future Congresses. So the law changes or statutory changes that have just been made can be reversed by a future Congress and a future president. The only thing that would be, I think, impossible to change is if there were somehow changes to our state constitution our federal constitution that could only be undone by a subsequent constitutional convention.
Right.
And just to add some more nuance to that, what we are hearing from our federal partners is that decisions to cut funding are actually much more easy to reverse, but decisions at the programmatic level that changes requirements are more difficult to reverse, given that it's fit in the weeds with the actual requirements.
That makes sense, Laura. Thanks. And Laura, also, I remember you speaking about the decrease in child tax credits. Lorna asks, isn't there an increase in child care modification and dependent care assistance?
That's a great question, and I don't have the specific facts and figures off the top of my head. I don't know, Scott, if you know more about it, but my understanding is that what's in the child tax credit in terms of who is eligible has been narrowed so that less people are eligible for that child tax credit. And what you might be speaking about, Lorna, is a separate program that is not that child tax credit, which I don't have the details off the top of my head, but thank you for asking.
And the one final question, there is a question about, do we have California specific data on the impact of the reconciliation package? I believe we did go through that, and that is included in the slide. So I will be sending that out following this presentation. And one final question comes from an anonymous attendee, and they ask, can you define who is in the ACA expansion group?
Laura, should I take that on? Okay. Yeah. So as part of the Affordable Care Act passed in 2010, also known as Obamacare, that allowed states to expand their own Medicaid programs to encompass a larger share of their populations than had previously been included. So these are all folks with legal status. It's just Medicaid the rules used to be much stingier in terms of who could actually qualify for coverage. So you had to have a disability verified by SSI. You had to have children, dependent children. There were other categories of eligibility that you had to meet, but that left out millions of people who didn't fall into those categories, including lots of people who do have chronic conditions and disabilities where they have not been able to get the government to acknowledge that they have those conditions because the federal government makes it very challenging to show that you have a disability. So essentially what they said was, if you are an adult and you don't have dependent children living at home, and you don't have this, quote, verified disability, but your income is below a certain level, 138% of the federal poverty level, which is very low. I wouldn't advise anyone to try to live on that income in California. You can come onto the Medi Cal and get health care coverage to meet your needs and the needs of your family. Again, I want to emphasize we're not opposed to undocumented immigrants having healthcare coverage. My organization supports that, but I want to emphasize the federal government has never provided funding to support undocumented immigrants through Medicaid. So all the folks who gained coverage through the ACA expansion in 2014, these were folks in California. They just had low incomes. They worked in jobs that either did not offer insurance or offered very high-priced insurance for which they got little in return, and they were basically part of the uninsured. This allowed folks to come into a program and get their healthcare needs met at very low or no cost.
Great. Thank you so much. And with that, we've bumped up against our time today, and we've been able to answer many of the questions that folks asked, and we covered a wide range of topics here. Thanks so much for squeezing in so much information into this webinar. So Scott and Laura, thanks so much for joining us. It's always such a pleasure to have you join us and share your expertise with our community. I would like to add that I will be including contact information for folks at the California Budget and Policy Center. So if there are further questions that people would like to reach out and try and gain some clarity around, please feel free to do so. With that, I'd also like to thank all of our attendees and registrants for joining. The engagement on the chat and the Q&A has been really wonderful. We really appreciate everyone joining today and lending their voices for such an engaging conversation. It really makes these webinars much more applicable and interesting for all of us.